This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. I'm Kyle Wigg sitting in for Dave. You're going to hear from Dave later on this morning as he will host Metro News Talk Line. And Mike Nolting will be along for the Talk of the Town after our show at 9 o'clock. But thank you for listening to Mon Health Talk, and thank you for joining us. Our guest this morning, Dr. Michael Englund, and also Tyler Reed. Tyler is a certified family nurse practitioner with Mon Health Systems. And gentlemen, good morning.
Good morning. Good morning.
Thanks for coming on. February is Heart Month. We want to put an emphasis on heart health, and we'll talk about that in just a moment. But first, let's get some background information. First on you, Dr. Englund, your background, where you're from, and what makes Mon Health System such a special place to work.
First of all, Kyle, thank you for having us. I originally grew up in Detroit, Michigan. I had the pleasure of doing my undergraduate at Charleston University, West Virginia, and then I moved on for med school to Lewisburg, West Virginia, did my internal medicine training at Ohio University, then came back to West Virginia because I loved it so much to Marshall University for my cardiology training, and I then went to Riverside and Columbus for my interventional training. Started then a small heart hospital in the southeast part of Ohio and have been practicing up here in Morgantown since 2013. I've very much enjoyed it with Mon Health. It's a super hospital that has always really worked hard at trying to achieve the best care it can for its community. We really work and take a lot of pride in that. We're accredited in more than one area of physiology, such as EP, as well as a chest pain heart center. Mm-hmm. I think my favorite part about working with Mon General, I really love my colleagues. We're bringing new procedures to the state. The system continues to grow and giving more excellence in heart care, such as we're really pushing the cutting line on things we can offer the public to improve their health care, such as we're doing structural heart, we're putting valves in through the groin, we're working harder on electrophysiology procedures where patients don't have to be on blood thinners as much with the Watchman. We're currently enrolled looking at treatment procedures to help with uncontrolled hypertension, working on the renal arteries. But the growth continues, and the excellence is by far superior than any place I've worked for.
So you've been here for over 10 years now, and a part of the community, just like the Mon Health System is part of the community. Tyler, how about you?
Hi. Thanks again, like Dr. Englund said, for having us on. So I'm originally from Alabama. We moved to West Virginia in 2002. I attended undergrad at Alderson Broaddus College and worked as a bedside nurse in the critical care setting at WVU Medicine for just over 7 years. I started my master's program at West Virginia Wesleyan College in 2020 and graduated in December of 2022. And I've been a part of Mon Health since late August of 2023. Still trying to navigate a new role, and the nice thing about cardiology is that there's always something new to learn. It was not my background going into it, but working with Dr. Englund and the other cardiologists, as well as my fellow advanced practice providers, has been a big help. My favorite part, honestly, about working with Mon General is that it's a very personal relationship with not just your coworkers, but also with your patients. Patients here feel that it's more of a small town feel where you get to build a really good rapport with your provider.
Mm-hmm. And as we mentioned, February is Heart Month. Well, everybody should, every month should be Heart Month, right? We should always be concerned with our heart health. But what's the message there, Dr. Englund, in terms of people right now, if you're taking an account of where you are health-wise, with your diet, how much you exercise, your weight, how you feel, what should we be thinking, always wanting to better and help with that heart health?
So I agree with you. It should be every day. Growing up, I used to hear this thing like, oh, next year will be easier. And as we get older, I think we find that just our problems change, and for the most part, new ones come on, and things don't necessarily get easier. They just get different. So I think as individuals, we always have to strive on our personal health to be in our best form and our best individual that we can be at every moment. So with that, each year, I think patients need to work hard, taking accountability to their health, knowing what meds they're on, not expecting their partner to memorize that list, them truly being involved in their health care, working on their diet every year, trying to eat better, as well as exercising. With diet, when we look at the American diet, when we're younger, we eat probably 3 square meals just because we're going through school. As we start becoming adults, breakfast starts falling out of the picture, then lunch, and we end up eating all our calories right before we go to bed, which would be the worst thing. So I would say that people have to go back to the basics and really trying to eat 3 square meals, picking a cutoff time where they're not going to eat any more junk food, try to avoid grazing, and really putting exercise in there at least 5 days a week, 30 minutes, but preferably 45 minutes, and if they could, go 7 days a week.
So those are all seemingly small things, but they certainly add up. Absolutely. You make some small changes in your lifestyle, and they all add up. Tyler, what's your role in this? When a patient comes to the Mon Health system and they've got heart issues, or they're looking for some guidance in terms of diet and exercise to help them feel better, what's your role on the front end of this?
So I just try to give them, like Dr. Englund said, just try to talk about the basics. If patients are really struggling, we do have a health coach that we can relay them to that is really good about helping with diet and giving them tips on exercise, just to make those small changes that do eventually lead up to the big changes down the road.
And what's your role in working with the doctors? How do the two of you, and Tyler, how do you work with the other physicians there? How do you work together?
So primarily, each of our cardiologists have an advanced practice provider, either being a physician's assistant or nurse practitioner that works with them closely. But we overall work together. If Dr. Englund, is for some reason out of the office or is out of town, I still will work with the other providers, and everyone pretty much has an open door policy that if you need guidance or you need assistance when your primary go-to cardiologist isn't there, you can go to anyone and speak with them. Dr. Englund and I essentially work together with his patient population that he has built up over the years, and we alternate seeing them at different intervals for their appointments. And I'm essentially just an extension of him, and that's what I try to tell patients. Whatever I'm instructing patients to do is coming straight from him, from the education that he's given me.
Mm-hmm. And Dr. Englund, if someone is out there and, obviously we should all have a primary care physician that we go to once a year at least, if not twice a year, and get that physical examination, get that checkup. What are some early signs? What may be a red flag or two that we may have issues heart-wise, vascular-wise, that we need to maybe see a further specialist for?
Well, I think that's an excellent question in the sense that it's pretty clear when it's the typical symptoms like the substernal chest heaviness or pressure that's really reproducible with activity. But it's the subtle changes that I think people miss, such as more shortness of breath or doing less or having less energy. For women, they're very atypical symptoms, back pain, sometimes neck pain, arm pain, but a lot of shortness of breath with women. But it's the small changes that I think patients have to be aware of that could be leading to a heart issue. Sometimes we'll see patients that continually get treated for lung issues such as pneumonia or bronchitis, and it's really an early sign of heart failure because they're not getting better and they keep getting put on antibiotics with no improvement.
Mm-hmm. How can we tell? This is a very difficult question, but you talk about the lack of energy and the shortness of breath and not being able to do as much. How do you differentiate that between we're just getting older?
Well, that's the key, my friend. I mean, you're spot on. So I think that, patients will constantly ask me, like, hey, I want more energy. I have no energy. I'm too tired. And our first question will be like, well, what do you do for that? Well, I'm not doing anything. Well, the human body, it's kind of like what Newton, a body at rest remains at rest. So if you want to have more energy, you have to put effort into that. Now, if you can't attain it for good reasons, I think those would be the red flags that something's going on. But my patients that live the most, I mean, having the privilege to talk to the 90-year-olds, I always ask, well, how did you get here? And the ones that really make it great are the ones that say, I just don't stop moving.
Yes, very good point. I mean, that's the key to it all. Absolutely. Tyler, what about some tips that you may have? What can people look for, or what can people do perhaps to beyond the obvious of diet and exercise to kind of keep that heart healthy?
I mean, biggest things like a diet obviously is a very broad term, but try to stay away from processed foods, limit your salt intake. You don't have to eliminate it, but I usually tell patients limit. Avoid a lot of sugars. Fruit, vegetables are always important. Always check your blood pressure as often as you can, and stay on top of your blood pressure if you have any issues with elevations in your blood pressure. That's a big thing that we always try to tell people to keep a close eye on, because it's just something small that if you don't check it over time, things can change, and that can be kind of an early indicator as well as some future incidents could occur.
Okay, so fluctuations in blood pressure?
Yes, sir.
Okay, very good. We are with Dr. Michael Englund, cardiologist with the Mon Health System, and also Tyler Reed. He's a certified family nurse practitioner with the Mon Health System. February is Heart Month, and if you heard this program from the very beginning, you heard Dr. Englund go through a long list of things that the evolution of medicine and the way things are advancing. And we're going to talk a little bit about some of those things with him when we return. Stay with us. You're listening to Mon Health Talk for this Monday morning. We'll continue on WAJR after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Wednesday. Thanks for joining us. Our guest, Dr. Michael Englund, cardiologist with Mon Health Systems, and also Tyler Reed, a certified family nurse practitioner, and they are with us on Mon Health Talk. Dr. Englund, again, you went through a list of all the things that Mon Health is at the forefront of in cardiology. And one of the more intriguing things, I think, is this Watchman technology. Can you kind of explain that briefly, what it is and how that has helped patients?
So the Watchman comes into an area with patients that have arrhythmia, such as atrial fibrillation or atrial flutter. These rhythms have a tendency to want to cause the heart to form clots, and clots, when they dislodge, especially on the left side of the heart, can go and cause strokes, heart attacks, ischemic cuts. They're really bad outcomes. So in the past, our only choice for helping prevent that was Coumadin originally, which is a great medication, but it's just very difficult to take. And then recently we come in with these factor 10 inhibitors that you don't have to have blood checks and you can take them, and they've worked very well. With that being said, not all patients become good candidates for blood thinners, such as patients get older and they're falling more often, or patients will come in and have a big GI bleed, or they have professions where this anticoagulation really wouldn't mix well with them, that they would be at risk for bleeding somewhere. The Watchman device is a device that goes into the left atrial appendage where most clots form, and it will help allow tissue to grow over that area. And over time, when this occludes, they can decrease their risk for forming clots. So if we said that blood thinner was about roughly 98% protective, this Watchman device gets you up to like 96, 97%, which is really a good second choice for patients that can't be on anticoagulation.
You've explained that very well. And another thing you talked about was the kind of evolving science of valve replacements, and that's become less and less evasive, right?
Correct. Boy, that's really exciting. I mean, there was a day where we could only do valves in the OR, which, again, as everything evolves, but now we're doing aortic valves through the groin. Patients are actually going home the same day and having very minimal, just conscious sedation, which is just amazing. We're also working on mitral valves, making them less leaky, which is amazing. And they're even heading towards tricuspid valves. So the heart system just keeps evolving, and I could smile and talk about it all day.
and again, Mont Health right at the forefront, at the cutting edge of these technologies. Tyler, what again? If someone is experiencing some symptoms, first of all, the chest pain. How can you tell whether if you're feeling symptoms? You need to do something immediately. What would you say to someone out there who maybe for now experiencing some minor symptoms?
So, if they're experiencing chest pain, we also look at maybe some associated symptoms. If the chest pain is occurring, like Dr. Englund said earlier, with activity, but it's alleviating with rest, they should probably follow up with their primary care provider and then maybe even be sought out to see us as well in cardiology. However, if this chest pain is something that isn't going away and it's constant, if there's shortness of breath that's associated with the chest pain, if there's any radiation of that pain to their back or arms, then they should seek medical attention sooner rather than later.
And how do people learn more if they want an appointment, if they want to get involved? Tyler, how do they learn more? How do they contact you and kind of get that process started?
So to get in with us, they would have to see their primary care provider and ask to be seen by a cardiologist. And whether it be myself and Dr. Englund or any of our colleagues here in the office, they would just need to seek out with their primary care provider and have them referred to us. Now, if they were to come in, as an emergency patient, we would see them in the hospital and then follow them up outpatient, depending on what their symptoms are and what interventions we may have to follow through in the hospital with them.
Yeah, of course, that's what everybody wants to avoid, though, the emergency situation. And again, you draw attention to this. February is Heart Month. Every day and every month should be Heart Month, but obviously you're trying to draw attention to this February being Heart Month. And gentlemen, we appreciate the time this morning. Excellent information, as always. And again, you can go to monhealth.com/heart to learn more about what they do and how to contact the physicians and the FNP like Tyler, the work he does. Again, guys, great information. We appreciate your time. Thank you very much.
Thank you. Thank you.